I'm Dr. Michael Higgins, hip and knee replacement specialist with Tidewater Ortho. I'm going to discuss the advantages of a total hip replacement done through the direct anterior approach, or the Jiffy Hip procedure. I'll explain why the Jiffy Hip procedure is a superior method of hip replacement that allows for a quicker recovery with less postoperative pain and less postoperative weakness. While there are many advantages to the Jiffy Hip procedure, the most significant advantage is the rapid recovery. Patients routinely go home the same day. Patients are up walking and climbing stairs an hour after surgery. This means less time in physical therapy, less time walking with a cane, and less time walking with a limp. The rapid return to normal pain-free mobility is a game changer for patients. It allows individuals to achieve independence and return to daily routines and active lifestyles much faster than they would with a normal traditional hip replacement. Why is there a quicker recovery with the Jiffy Hip? The primary reason is that the Jiffy Hip procedure is a muscle-sparing hip replacement, meaning that no muscles are split or cut in doing the surgery. This allows patients to have less postoperative pain and less postoperative weakness. This is in comparison to a traditional hip replacement, where muscles are split and cut. So with the traditional hip replacement, the hip joint is entered from the side or the back, and the gluteus maximus muscle is split. Beneath that, muscles are cut off of the femur to get into the hip joint, and then the surgery is performed. But obviously this causes a lot of disruption to muscles and to critical soft tissues. With the Jiffy Hip procedure, the hip joint is entered from the front, like so. And the work is done working between muscles without cutting or splitting any muscles, so that there's less postoperative pain and less postoperative weakness. Precision is another critical advantage of the Jiffy Hip procedure, and that's because there's enhanced visualization of the hip. The primary reason for this is that fluoroscopy, or a portable x-ray, is used on the fly with ease during the procedure. This is done more easily with the Jiffy Hip procedure because the surgery is done on a special table with the patient lying flat on their back. And this allows for precise implant positioning, allowing for optimal alignment and stability of the patient's new hip joint. This also allows for precise correction of leg length deformity. And in patients that have more complex anatomy, robotics can easily be incorporated to a Jiffy Hip procedure. Lower risk of postoperative hip dislocation is another advantage of the Jiffy Hip procedure. This is because there's more intrinsic stability to the hip joint immediately after surgery, because the muscles have been left intact and more of the critical soft tissues are also intact. Additionally, there's optimal alignment thanks to the use of fluoroscopy. So there's enhanced stability and a lower risk of dislocation for patients following a Jiffy Hip procedure. For patients, this means peace of mind during the recovery. Lastly, there's fewer restrictions on postoperative activities with the Jiffy Hip procedure. Thanks to the decreased postoperative pain and weakness and enhanced stability, patients can routinely resume normal activities sooner than with traditional hip replacement. Whether it's getting back to work, enjoying hobbies, or participating in physical activities, the Jiffy Hip procedure allows patients to live life to the fullest. If you or a loved one are suffering with hip arthritis, schedule a consultation